There we go. Well, welcome everybody. My name is John Fortune. I'm the Deputy City Manager for the City of Dallas, and I represent the public safety departments for the city. And I want to thank you for joining us this afternoon. I want to thank the Senator for compiling this group together. We have a very informative and important discussion in front of us today, and I'm looking forward to hearing from our special guest. Before we get started, I want to acknowledge that we have several special people with us today. First and foremost, Sandy Cornyn, Senator's wife, is joining us. Thank you for being here. We also have Council Members Blackman, Council Members Basil Dua. They are leading the city's opioid task force, strike force, on this topic. And also with us is Councilmember Moreno, which this fire station resides in his district, so thank you for hosting as council member. So we have a good discussion, robust discussion today. We're going to hear from some special guests. I'll introduce them as we go. I will like to say that for each of the guests, if you could kind of keep your comments to about 5 minutes to make sure we save time for everybody, that would be very helpful. And now I'm going to turn it over to Senator Cornyn and ask that he kind of kick us off with this discussion. I want to thank you, Senator, for being here. As you know, Senator Cornyn was first elected in the U.S. Senate in 2002 and is currently serving his fourth term and represents more than 30 million Texas. Senator Cornyn is a San Antonio native, but we certainly are proud to have you with us today, sir, in Dallas. So thank you very much.
Thank you. Well, thank you very much for your hospitality, typical Dallas hospitality. It's good to be here. Dominique, thank you for hosting this event at Dallas Fire Rescue, and to John for the introduction. It's no secret that communities across Texas and across the nation have been plagued by the scourge of cheap, plentiful fentanyl, synthetic opioids. I was just mentioning that one of the things I've learned on my travels is, for example, in places like Colombia, that are known primarily for illicit cocaine, that they make the point that you don't have to grow anything to make synthetic opioids. It just takes precursor chemicals that you can mix literally in any environment and at a place very hard for law enforcement to detect, and then make it look like something innocuous, relatively innocuous. So people who actually take it don't necessarily even know that they're consuming fentanyl, and of course, as we know, tragically, with fatal consequences too many times. I particularly want to thank Cynthia and Marissa and Colin for sharing your personal experiences today. That's very important, but it takes a lot of courage, and I know reopening some painful memories as part of that process. I had a chance with the district attorney to be in Carrollton Farmers Branch in April, and one of the dads there who lost his daughter, Sienna, gave me a bracelet that I wear, a rubber bracelet with her name on it, and also the legend, "One pill can kill," which is important to remember because people who consume fentanyl don't necessarily know they're doing it. That's why we call this fentanyl poisoning as opposed to overdosing on the drug, but the consequences can be the same. This is National Recovery Month, and it's a time to help raise public awareness about this problem, because this is a conversation that every parent needs to have with their child, and every school administrator needs to have this conversation at their schools, and just to raise public awareness so people don't inadvertently consume some of this poison. More than 1,100 North Texans have died of fentanyl poisoning since 2021. That's a sobering statistic. And approximately 240 have died this year alone. Nationwide, overdose deaths involving fentanyl and a stimulant increased 50-fold between 2010 and 2021. And of course, as I said, many victims have no way of knowing whether if a pill is laced with this deadly drug. I recently introduced a piece of legislation called the Fentanyl Stop Act, which would increase access to fentanyl test strips, which I believe will save lives. So if people can actually ascertain what it is that they're getting ready to consume and avoid taking that fentanyl-laced pill, it will save lives. I've also introduced legislation to expand access to opioid reversal medicines, and another bill to train Mexican military forces on how to combat the cartels and hopefully stop this on the supply side, deal with it on the demand side, and to help everybody in between. So I'm hopeful that these bills and the public awareness that we will raise today with the help of all of these folks will help inform the public so we can protect ourselves and particularly protect those who have no knowledge of what it is that they may be consuming. So with that, let me turn it back over to John.
Thank you, Senator. Thank you, Senator. I appreciate those comments. For our next speaker, I'm going to turn it over to Dallas Fire Chief Dominic Artis, and he will provide some information from the Dallas Fire Department and also introduce the next speaker.
Thank you, Mr. Fortune. As we begin to look at this problem that was facing our city, we had a conversation with some of our partner agencies as well as our task force leaders, our council members, to see how we could be effective in not only education, but also creating a program that impact lives. And so I tasked that to Section Chief Scott Kumpler, and he did a great job of really looking at the problem and bringing solutions for us here at Dallas Fire Rescue. And so I'll introduce Scott to give you some insight into what this team does and how it's been used here in our city.
Thank you, sir. Section Chief EMS. We identified that we had a problem. In 2020, we administered 900 doses of Narcan across the city. By 2022, that number had gone up to 2,100. And by doubling, that showed we really had an issue that was a challenge for all of us. Becky, with Recovery Resource, approached us about putting together a team with some grant funding to really respond and help the people in the most need. And so beginning in January, we launched our overdose response team, which is a partnership with Resource Recovery. It's a position that is a Dallas Fire Rescue paramedic paired with a peer support specialist. And our ambulances go out and they administer Narcan to someone who's overdosed. And then 24 to 72 hours after that, this team comes around and offers that hopefully break the chain. They've attempted to contact 364 people this year alone and have enrolled 40 people type of a preventative measure, whether it be inpatient or outpatient. So that's close to an 11% enrollment rate. We'd like that to be higher. We have a grant we recently got with the county from the CDC to expand this team. So going forward next year, we'll expand this team and be able to have more outreach. On to Becky Ting for her.
All right. Senator Cornyn, thank you for your continued dedication to this important issue. I'm honored to be here today representing not just Recovery Resource Council, but all of the great agencies throughout Dallas-Fort Worth that work diligently every day in the areas of prevention, intervention, and treatment. Nearly 2 years ago, Recovery Resource Council launched our first overdose response team in Tarrant County. In January of this year, we successfully expanded the program to Dallas through a partnership with Dallas Fire Rescue. These teams, consisting of a paramedic and a certified recovery support peer specialist, follow up with individuals who have survived an overdose within the last 24 to 72 hours, offering them education, resources like Narcan, but most importantly, a connection to a team of professionals who provide individualized support and guidance, working to find a long-term solution for their substance use. As Chief Klumpner just shared, since its inception, our Dallas team has followed up on over 300 overdoses in just a matter of about 9 months. We've served over 160 survivors and their loved ones, and we've facilitated warm handoffs to additional treatment resources for over 35 people. Every day, our team sees firsthand that fentanyl knows no bounds. It doesn't care how old you are, what zip code you live in, or how much money you have. More importantly, it doesn't care if you've been a longtime user or if this was your very first time. It only takes once. The CDC recently released 6 principles they're using to guide their work in addressing the overdose crisis, and one of those principles is driving innovation. Programs like the Overdose Response Team are an example of just that, but we must keep pushing. This crisis will require many new innovative approaches to tip the scales towards lives saved rather than lives lost. Harm reduction tools like fentanyl test strips are another example of such innovation. Test strips will not solve the overdose crisis, but there is more than one way to decrease the number of people dying from fentanyl, and this is one of them. And we must use every tool that we have available. Narcan and fentanyl test strips have the potential to keep people alive long enough to learn from their decision, to choose a different path. An opportunity that fentanyl has ripped away from far too many people. People who had absolutely no idea what they were ingesting. For those individuals whose lives we save, then what? The demand for these fake pills is a symptom of the disease. We have a society of young people who are clearly suffering, and there's not sufficient resources to meet the current level of need. So in addition to the innovative approaches and the new ideas, we must also continue to advocate for affordable and accessible treatment for both mental health and substance use, especially for our youth. One important takeaway from today is this. This crisis is complex and multifaceted. Therefore, the solution will be as well. But it starts with these conversations, giving everyone a seat at the table. So, Senator, thank you again for facilitating this conversation and giving us all a seat at the table.
Thank you. Appreciate those kind words. And we also, the information you shared, but also we appreciate the partnership that we have with the Resource Council. So thank you very much. Our next speaker is Darylyn Cordona-Byler. She's a Senior Vice President of Specialty Health Care with the Meadows Mental Health Policy, and she's going to talk to us about another important component of this crisis, which is the intersection of mental health and opioid abuse.
Good afternoon, everyone, and thank you very much, Senator, for having us at the table to have this very important conversation. I am honored to be here, and as a clinician, as a mental health professional, and as a mother of 2 teen daughters that we know struggle, this is very close to me, close to my heart. This month, we celebrate National Recovery Month, and what that really means is that we celebrate all of those who are recovering from substance use and mental health conditions. In our cities, in our circles, we all know someone who is impacted by a behavioral health challenge. We have a son, we have a daughter, we have a family member, a neighbor, a colleague, that is struggling. So this is something that is impacting each and every one of us. Compared to 2021, what we're seeing across our state is that suicide rates have increased by 4%. And deaths from drug overdose continue to increase. When we began 2022, we knew that we needed to do more for our youth. And at that point, we ended 2021 with a public health warning from the Surgeon General about the mental health of our nation's children. Since then, we have done substantial increases in pediatric mental health crisis across the United States, and a tremendous increase in crisis utilization and hospitalizations across the board. Mental health challenges and substance misuse are often intertwined, and at times we find ourselves asking people to go to multiple doors to receive the care they need. when we know that what is needed is comprehensive, holistic care that treats both the mental health condition and the substance use condition. These illnesses occur for a reason, and what we're seeing is across the board is that people with mental health disorders may use substances as a form to self-medicate. It's a way to alleviate symptoms like anxiety and depression, something that we're seeing in our youth that is so prevalent these days. This then can lead to addiction as they become dependent on the substance for relief. Individuals who have also experienced trauma, such as childhood abuse or post-traumatic stress disorder, many different types of traumas, are also at a very high risk of developing both a mental health and a substance use disorder as a way to cope with that pain, with that trauma that they carry. Something that we need to tackle is the stigma that really is at the core of all of this. So we find ourselves sort of like wanting to talk about it, but not knowing how to talk about it. If we have a family member with cancer, we ask others to join us and to care for our loved ones. If we have a family member with mental health conditions, we may not want to say that. But now we are normalizing the conversations. If we have a family member that is struggling with substance use, we will never say anything because the stigma is so intense. And that stigma is really preventing people from seeking the help they need. Across all of this, we know that we have good news, though. We know that there exist treatments that work. There are best practices that when individuals are supported with the treatment and love and family and connections, they can thrive and achieve recovery. And across the board, we all want to say that recovery is the ultimate goal. And what I like to say to myself, and I like to tell others, that yes, that is the ultimate goal. However, we need to make sure that we do everything in our power to keep our children and our loved ones alive. And that includes this tool. And if we have the ability to provide the tools to keep people alive as they then join the recovery journey and walk the path with them, we know that that recovery is possible. And across all of this is just keeping hope. It's important for us to keep hope for a better future. Because, as we celebrate recovery, that's what recovery really is all about. It's keeping hope and making sure that we're keeping hope for others as they struggle. Thank you.
Thank you, Darlene. We appreciate that. So our next speaker is District Attorney John Creuzot, who's another excellent partner with the City of Dallas. He's going to speak to us about his office's strategy and success prosecuting fentanyl dealers and traffickers.
Thank you. Thank you for inviting me, and thank you, Senator, for being here again. Before I talk specifics, I think that what we're seeing here is an effort to each of us come out of our silos and stop doing the very specific jobs that we're doing and to come together. And one of the entities that I'm so proud of on this is the fire department. And it was several months ago that I heard about your program, and I thought, this is the best thing. You are the ones first on board with someone, and you're transporting them. You have the information that's necessary, and we know from research and practice that the most immediate intervention is the most effective. So I want to say thank you for what you're doing. The other thing is I want to thank two people here, Paula Blackman and Adam Basildua from the City Council members, because without them and their interest and engagement in pushing the issue forward, we would not have overdose mapping in the state of Texas. That is my opinion. And so thank you all for doing that. I can talk about a lot of other things that we've hit on here, and that's mental health and substance abuse. And, you know, one of the things that I always said coming into this office of district attorney and now that I'm here is that I too have to break down silos, and I too have to get out of my place of strict prosecution and join in with the city and with departments and with other entities, nonprofits. And so just to give you all an idea of what we've done when we break down our silos, we have used civil asset forfeiture money, money that comes from criminals, and we prosecute that. We prosecute those cases, and we collect the money, and we give the vast majority of it to our law enforcement partners. But we've actually spent $250,000, to you all's point, to the Right Care team for the city of Dallas, for their police, so that they can do a better job. And we're proud of that. We also recently gave $146,000 to the Dallas Police Department for Narcan and fentanyl education across this city and across this community, and we get lots of returns on that. It is our desire not to see someone either deceased or charged with a crime. That's progress for us. And so to the extent that we can engage with others and break down the silos and make these accomplishments, we're very happy to do so. We've also been on the forefront of putting medically assisted treatment protocols in jails, in the Dallas County Jail, and also in our inpatient facilities run by Dallas County, so we're very proud of that also. But just to give you an idea of where fentanyl is with us and with the district attorney's office, we started keeping our numbers back in September of 22, and I think we all know that this kind of just popped on us, so to speak, and so we started tracking what we're doing. I got a bunch of numbers here, but the only ones that really matter is that we've disposed of 171 of those, and we have 264 that are active. The other numbers are much less, but we expect to get more. We hope to get less. We hope that your intervention means we'll get less. We hope that you doing your job means that we'll get less. And Senator, we hope that your advocacy of testing strips means that we will get less and they will see fewer people that they have to go pick up. And of course, the one person who's here who I really want to thank you for continuing to have these kind of town hall meetings, are you, Senator Cornyn, because what you are showing us that our values and your values are in sync. And what you are doing is taking back this information to Washington and getting together with your staff, and you are drafting meaningful legislation that will help all of us do our jobs better and keep us from opening the paper and seeing that another life has been lost. So we want to thank you for what you're doing. Thank you very much. Yep. Oh.
Sorry about that. Thank you, Judge. We appreciate your comments and your partnership. We're going to change gears just a moment. We're going to now turn our over to our next three speakers, three individuals who know firsthand about the devastating impact of this epidemic. We'll start with Cynthia Pursley. She's the CEO of Livagy, who will talk about her personal experience and what she's currently doing to help fight back.
Thank you. Good afternoon. I'm Greek, so I wrote it down so that I don't speak more than 5 minutes. So I'm going to try to keep it under control. Thank you, Senator Cornyn, for inviting me today to this roundtable. Thank you, Brian, for inviting me as well and giving us the opportunity to tell my story and also to tell the story of Livagy and what we're doing to combat this epidemic that is taking over our country. So there are actually 4 people that I know personally that are not here today, unfortunately, because of fentanyl overdose. One of them was my stepson, Brian. My name is Cynthia Pursley, and I am stepmom of 3 and a mother of 2, and I'm also the founder and the president of Livagy. We formed Livagy 6 months ago in remembrance of my stepson to celebrate his life, but also, honestly, one day I woke up and I said, you know what, we have to do something to change this. I need to do something, so hence Livagy was commenced. And our mission is to offer support and best practices for preventing overdoses and deaths. We distribute our unique naloxone or Narcan, whatever term we want to use today. We created a dispenser that we distribute throughout Texas. I'll go into that here in a second, primarily in the North Texas region. And what it is, it's a very simple modular dispenser that goes on the wall. And what you do is you rip out the front, you grab your Narcan, instructions are on the back. We're also having the instructions in Spanish now as well, so that will be incorporated on there in the very near future. So this is really how we started our mission in distributing this, okay? And so Livigy, what does it mean? It's a combination of two words, to live, which means to stay alive. Synergy means the combination of two is better than one individually. So what we found is that we needed to collaborate. We collaborate with other organizations, with other groups like ourselves, and now with you. So that's where we found it so important to collaborate and join in our efforts. Little history about Brian. This is my stepson. And Brian read Plato. He read Socrates. He read Aristotle for fun. Who does that? I don't. So I brought one of his favorite books with me today. Brilliant young man. He worked on Wall Street. When he fell upon hard times, he unfortunately became one of the statistics in 2022 and passed away alone on the streets of San Francisco. He was robbed, and it was difficult for them to really identify him. And then I received that call at 2 o'clock in the morning. So a very frightening evening, and I'm very close to his mother. And together with all the kids, we've been able to celebrate Brian's life and learn from that. And we talk about him all the time, and he's always in our heart. So also, who am I? I'm a manager for the Quality Field Operations team for a major healthcare provider here in the Texas area, actually nationwide company. I'm in charge of the North Texas region. And what we do is we work with providers, with physicians to help keep people healthy. What we want to do is keep them healthy. We have preventative measures. We want to make sure you're getting that colonoscopy and you're getting your mammogram. So that's what we do. My team is from El Paso all the way over to Shreveport. So, but I only say this so you know why and how we found it and really the structure of Livigy, because we had to incorporate some of the structure that I know from my corporate job to relay it into what we do today. We have 4 target markets. The first one is establishments with mixed beverage permits. Number 2, parent-teacher associations. 3, fraternities and sororities. 4, public outreach organizations. I'll go through these briefly and what we've done. We, with the Mixed Beverage Association, the TABC recently passed a law that if you have a mixed beverage permit, you have to train your staff in the signs of overdose. And we were already starting to do this and go to and we give this for free. And so we train the staff on the signs of the overdose. We give this for them and ask them to keep it behind the bar, in the office, somewhere where it's visible for everyone, so that if there is an overdose, regardless if you think it's an overdose or not, it could, it's a diabetic reaction. And so we try to get rid of that fear. People have asked me, well, I'm not in scrubs. I'm like, I'm not in my scrubs either, so it's okay. You don't need to be in scrubs to do this. So that's where we have tried to lessen that fear, that intimidation of saving someone's life. We created our own little mapping system that what we did is we overlaid all the bars and restaurants in the area that have a mixed permit with where we go. So, and then when we go there, we know we've gone, and the only thing that we ask from them is if they use it, that they scan our barcode, let us know, and we're going to send them another one immediately so that there's never a lapse in time. And also we're going to start putting stickers on the front of windows so that everyone knows. The Grapevine Police asked me, they said, how do I know if a restaurant has it? And now we're going to be putting stickers outside on the door so that the police officers know if they don't have their Narcan, naloxone with them, wow, I saw that sign, I know where I can go. So that's our mission there. Fraternity sororities, I'll pick up the speed here, guys, sorry. We have been contracted actually by several fraternities, and what we do is we train them. We talk to them about fentanyl, we discuss the dangers, and then we teach them how to use Narcan, and we give them also 1 or 2 or 3 of these, how many they need, for their house, so that they have this available. The most humbling experience was last Sunday night. A young man came up to me and he said, thank you for doing this. We didn't know. And I said, tell me more. He said, we pass Adderall around to each other all the time. We didn't know. And I said, never take anything from anybody, even if it's in a prescription bottle, from your friend. Just don't do it. So, getting involved on that one-on-one level is we have found very rewarding, and I think our message is getting across to them that way. Also, public outreach organizations we've distributed to the Salvation Army, food banks, UTA Health Center, Grapevine Police. I mean, there's a lot. The list goes on. We were thank you, Dallas Morning News, in the Deadly Fake series. So, a lot has been happening. We've done this for 6 months, and our projections are to just go stronger. It's a great team. I have my two, where did they go? There they are, my youth ambassadors over there. And just a little bit about my opinion, I love what you're doing, Senator. By, criminalizing test kits and other harm reduction methods, we have removed the few safeguards that are in place. This is a safeguard. This is something that's going to help us, those that are the boots on the ground. So we are supportive of that, and I thank you for your initiative on this. Knowledge, awareness, everyone's life matters. So what we're trying to do is get the message out there, let people know what is happening. Also, there's the funding and the grants. That one is a little challenging to navigate through, to be honest with you, sometimes. So I appreciate the bills and the initiatives that you're doing for us. We started this with zero money, and what we've conquered and accomplished so far, we've done with $15,000. So, you know what? We're going to keep fighting. We're going to keep going after what we need to do. Thank you for making it easier in the process. It's simpler for us to be able to fund and support more. And back to synergy is the cooperation of two, right? We need the government. We need you. And I really believe that you need groups like us. There's so many groups like myself, not necessarily doing this, but we're in correlation and in combination with. So I appreciate the opportunity for us to all work together to find a solution to this epidemic that is just killing all of our young ones, and it's really frightening. We, the grassroots, are holding hands, knocking on doors, distributing Narcan, educating the police departments. We are opening eyes and hearts. Let's, decriminalize the fentanyl test strips, simplify the grant process, which I think is important, and that way we can do our job. Our job is to save lives. That's what we're committed to doing, and that's what we want to do. So staying alive together is our logo, and this is also in remembrance of the 4 individuals I mentioned in the beginning. I work with their moms and the husband of Kyle Helsman, Drew Crow, Brent Crawford, and Brian Persley. May their memories be eternal, and may they always be with us. Thank you.
Thank you, Cynthia, for that very personal story. We appreciate that. Our next 2 speakers are Marissa Gonzalez. She's the mother of Colin Temple, and Colin is going to share his very personal story with us. First, we're going to talk to Marissa. And Marissa, since we've got a 1 microphone situation here, when you're through, if you'll just pass it to Colin, and I'll pick it up from you after that, Colin, okay? Thank you. Marissa.
Pass it around. All right. Good afternoon, everyone, Senator Corner, and everyone here today. My name is Marissa Gonzalez, and I'm the proud title of being called Colin's mom. It's an honor to be here with you today and to briefly share my experience as a parent of a child who has survived a fentanyl addiction. I know most families don't have that privilege of saying that, and I'd like to express my deepest condolences to all the families that have lost a loved one to this. My son Colin started using marijuana over time and wanted something more, something stronger, and eventually started using fentanyl and became addicted to it. He couldn't stop. I witnessed his behavior changing from a sweet boy to a teenager that wanted to be left alone in his bedroom or just wanting to hang out with his friends. He was irritable. He slept all day, woke up in a bed full of sweat. His coloring was pallid. He just wasn't Colin. When confronted, he assured me that he had this under control, that he would take care of it, and I didn't need to worry about him. Until one night, I received an urgent phone call from one of his friends. He was desperately worried about Colin. They were playing video games while FaceTiming one another, and Colin passed out and fell into an unconscious state. He was unresponsive, and I called 911, and he was transported to the emergency room. Colin walked out of that hospital alive that night. Thank God. And I realized that most do not. Parents are in denial that this couldn't happen to their child or their loved ones, because I sure was in denial. We as parents don't want to admit the fact that our children use drugs or that they suffer from an addiction because of the stigma associated with it. But I'm grateful today that we're having this conversation to normalize having conversations about the dangers of drugs, and in particularly fentanyl. Awareness, testing strips, and Narcan, these will all save lives, and I'm so glad to hear that the city is stepping up, because we didn't have this program when he overdosed and we nearly lost him. So I'm so grateful, because I didn't know how to navigate through the system to find help for him. I had to do that all on my own, and boy was I lost. So if you know someone who's suffering from addiction, please know that you can't do it on your own, that there is help out there. The first step is the hardest step towards recovery, but it's worth every step. And I'm proud to say that Colin has been clean for over 2 years and 1 month. And it's my proud honor to introduce to you today my son, Colin Temple.
Hello. First, I'd like to thank everyone for coming out today, and thank you, Senator, for having me. I was in active fentanyl addiction for 2 years, and it was mentally and physically addictive. Without it, my body felt crippled, my spirit felt crushed. It's something that I don't wish upon my worst enemy, and I feel like no one should have their hands on. And I feel like it's very important that parents and schools talk to their children and let them know the dangers of fentanyl, because there are many people that don't know how deadly and how effective this drug can be. I also believe that the inpatient treatment centers that we have in Texas, there is a lack of. My mom went to her wit's end to get me in a treatment center, and we had to go all the way to Mississippi, especially when young kids like me are now getting into fentanyl. There needs to be adolescent recovery centers as well, because you don't want your 16-year-old in a treatment center with a 50-year-old. But I believe that test strips should be outside of concerts, and there should be places where there is judgment-free disposal, testing, and people can test their drugs and go on their way. I also believe that the accessibility for Narcan should increase. I feel like every restaurant should have Narcan, and it is amazing, Cynthia, that you are doing that. And I think that's all I got for now. Thank y'all so much.
Thank you, Colin, Marissa, and Cynthia. We really appreciate your bravery, your courage, and just for sharing your story with us today. It's a good reminder for all of us who are trying to fight this to know that what we're doing it for. So thank you so much. So also to everybody else, I want to thank you for joining us and being a part of this very productive conversation, Senator Cornyn, for bringing us together. That concludes this particular part of the program. Next, we're going to have Scott and Becky show the Senator some of the things we use for the opioid response team. And then following that, if the guests who are here with us today will join the Senator behind this podium over here, I believe we're going to have an opportunity for a few questions from the media. So with that, thank you very much. Thank you, Senator, and thank you, everyone.
Let me start by thanking the Chief and Dallas Fire Rescue for hosting us today. Thankfully, the temperatures are a little more moderated, but I just want to say to everybody here that I applaud the collaborative effort that we've seen, including the city's overdose response team's partnership with the Recovery Resource Council. Of course, my old friend the district attorney, John Crusoe, who, like me, is a recovering judge many moons ago. But particularly, I want to thank Marissa and her son Colin, as well as Cynthia, who shared very personal stories about their experience with this terrible drug, synthetic opioids like fentanyl. This is not like a usual sort of what you think of when you think of people overdosing on drugs, because in this case, people don't even know they've consumed the fentanyl, but it's so powerful. This takes the pencil tip of a lead of the pencil to take your life. And this requires a multidisciplinary approach. First of all, law enforcement obviously plays a key role at the federal and the state level. And we know that the precursors, the chemicals that are used to make the fentanyl, are unlike any other drug, because they literally can be mixed in a closed environment that's not easily surveilled by law enforcement, and then manufactured by a pill press to look like something relatively innocuous. So when people think they're taking a Percocet or a Xanax or some other pharmaceutical drug, they have no knowledge of the fact that they've actually taken a drug that can take their life. And that's why we've seen such a great toll on our young people at schools all across North Texas and literally all across the state and all across the nation. I wear a wristband that was given to me by a father of a young lady named Sienna at Carrollton Farmers Branch in April, when the district attorney and I were there and others of us were there to talk about this. But we need to do everything from border security and interdiction of the drug. We need to do more on the demand side. We need to do more on the law enforcement side. Obviously, as you heard, mental health. We need to make sure that we give the first responders the tools like Narcan they need in order to save a life. So hopefully people can begin a path back to recovery like Colin has, who became addicted to this terrible drug. And so one of the biggest things that we can do is public awareness. And I applaud our friends at the Dallas Morning News for the series that they've run. And I want to express my gratitude to each of the news media here today to help us get the message out. Because this is a conversation that parents need to have with their children. Again, these kids may not understand what it is they're getting involved in, and they end up, unfortunately, suffering the loss of life in families like you've heard here today with Cynthia, who've grieving for the loss of their child, but have tried to turn this into something positive by making sure that other people will not lose their life by being better equipped to deal with the risk and to deal with the consequences. So this is, again, is going to take a multidisciplinary approach from the supply side, the demand side, the public health side, law enforcement, obviously first responders. I think it's going to take all of us to try to save lives here. And again, appreciate those who've had a personal experience with this, Marissa and Colin and Cynthia, for being here and having the courage to tell their story. I believe by having the courage to tell their story, they will help us save lives. So I'm grateful to them. So with that, I'm happy to answer a few questions. And if you have a question for some of the other folks here, please just shout it out. Well, as you heard, this is not something we can just put money in a mental health bucket or the law enforcement bucket or in the federal immigration border control bucket. We need to deal with this across the board in every different aspect of this crisis. One of the things that we have not done, I believe, in this country is deal adequately with mental health challenges that our young people are experiencing, many of whom lived in isolation during COVID-19. Their parents were fearful not only for their own health, but for their ability to support their families while their child was supposed to be learning on a computer assuming they had the luxury of having access to broadband and the sort of curriculum that they could use to continue their education. So there have been extraordinary stresses, I think, placed on Texans and particularly this vulnerable population. And unfortunately, one of the things people tend to do if they find themselves in a situation like this is to self-medicate. And that's where the problem really begins to be lethal. So this is going to continue to take an effort at the local level, the state level, and the federal level. And we gotta, this is not gonna get any easier because the drug is so cheap and so easily transported and the profit is so high that the cartels that are smuggling this across the border are going to continue to do more and more and more of this until we deal with the demand side and also deal with this in a border security and law enforcement side. Do the test strips encourage drug use? No. I don't think it's a close call. I understand the argument. Obviously, we don't want our children taking any sort of illegal drug of any kind across the board. As a parent, I don't want my kids doing that. But if they take something that they think is probably not going to kill them, something relatively innocuous for recreational or other purposes, they need to know whether this pill is contaminated with something that will kill them. And then hopefully with the public education, with the work that we've been doing in our schools, the work we're doing here today, people will be forewarned and forearmed. So it's going to take all of these different aspects of including the test strips, I think, to help save lives. So I don't know how many lives it will save, but I'm confident it will save some.
Yeah. I think that ought to be a new law, yes. And to answer your question specifically about test strips, I agree with the senator, but I want to put some context into it. A person who wants a test strip is already in addiction and already has impaired judgment, or they wouldn't want to go that route, okay? So to say that it's going to cause people to want to get addicted and want to have impaired judgment is just not true. And I want to put some more context in that. You know, I did drug treatment court for a number of years here in Dallas County, and I came across many people who had dental surgery and became addicted to opiates from that, C-sections, back surgery, et cetera, et cetera. These are innocent people who became addicted in the most innocent of manners, and the reason I saw them is because they got arrested, okay? So I don't think that we're contributing to an addiction problem. What I think we're doing, I think is the senator's saying, and I agree 100%, is what we're doing is helping from one direction only solve a much larger problem and save a life here or there. And if we can do that, we're on a winning path. Thank you.
So, maybe one more question. Well, we're not going to give up. And we're going to pass a law that is national in scope. And under the U.S. Constitution, the federal law can preempt state law. And so I'm not accusing anybody of doing anything wrong or not doing what they should do, but I think the evidence is clear, and I wish I was as articulate as the district attorney in explaining how these fentanyl test strips figure into the overall package. But we're going to keep pressing, and we're not going to give up until it's signed into law. Thank you all very much. Okay. So these folks probably don't want to stand up here with me when they want off-topic questions. you want to